Good afternoon. This is Judy Burleson, Senior Advisor, Quality Metrics at ACR. Welcome to everyone, and thank you for attending today to learn a bit about how to use qualified clinical data registries for reporting to Pqrs, for Pqrs. We're also joined by...
This is Maitreyi Chatfield, Senior Director for Data Registries at the ACR. And together we hope to give you a little picture of how you can get signed up and avail of this exciting opportunity. Just so you all know, this webinar is being recorded and will be posted. And if you have any questions as we are talking, please enter your questions on the chat or questions box that are part of your webinar interface, and we will get your questions at the end. So with that,
we'll go right ahead. I think. So we'll just go quickly through what this is all about, reporting to CMS for Pqrs, and review the incentives and penalties that are in place today. For 2014, this is the last year for the incentive at 0.5% of total allowable Medicare Part B charges. If you are also doing the maintenance of certification additional incentive, that's another 0.5% for a total of 1.0% incentive this year. If you do not participate successfully or fully in Pqrs this year, there will be a penalty of a -2% in 2016. That carries through to next year through 2017. The penalty will also be -2% based on, in 2017, based on 2015 reporting. So that is without the incentive for Pqrs. However, there is potential for a value modifier incentive starting last year for groups of 100 and more. For this year, in 2014, groups of 100 or more may be affected by a value modifier incentive or penalty of up to -2% is the penalty, of upward adjustment of a factor of 2 times a number yet unknown, because the program is budget neutral. In 2016, groups of 10 or more will be affected by the value modifier based on 2014 reporting. There will be a -2% penalty if you don't participate in Pqrs. That's on top of the Pqrs penalty. And there is a potential for an up to 2 factor in payment upward adjustment if you participate fully in Pqrs. And in 2017, the value modifier will affect all physicians based on what they do in terms of Pqrs in 2015. Just quickly, key changes in Pqrs. What we're here for today is that the Qualified Clinical Data Registry option was made available for individual eligible professionals to participate in Pqrs. Basically, what is a QCDR, a Qualified Clinical Data Registry? CMS defined it as an entity that they approve that collects clinical data for the purposes of patient disease tracking for quality improvement. QCDRs are typically registries that specialty societies have developed, like the ACR National Radiology Data Registry. When reporting Pqrs through a QCDR, measured data is collected across multiple payers and is not just limited to Medicare beneficiaries. The distinction between a qualified clinical data registry and the traditional registries that have been used in Pqrs for several years is that with a QCDR, you are able to report both non-Pqrs or registry measures as well as Pqrs measures. Some of the benefits for using a QCDR could potentially give you greater latitude to meet the reporting requirements of 9 measures across 3 national quality strategy domains. This may also come into play in a greater way in future years, where CMS may be increasingly strict in how they allow other reporting mechanisms to basically go around the 9.3 reporting requirement, such as with claims reporting and the measure applicability validation process. With a QCDR, you can meet multiple requirements or needs, such as Pqrs participation. You may also receive maintenance of certification Part 4 credit. All NRDR registries are approved for that purpose. And it's also a valuable quality improvement tool. Using a QCDR may support a better outcome under the value modifier program, where when you use a QCDR, your quality scores are easier to monitor and track throughout the year, and so you can improve throughout the year. The quality scores could be higher because of frequent feedback and monitoring, that you will receive reports from the registry during the year. And you have a greater choice of measures to report, which could mean that you potentially would have higher quality scores. Looking at the Pqrs requirements for using a QCDR, and for 2014, a QCDR is only available for individual eligible professionals. Group practices that are using the formal group practice reporting option, the GPRO option, aren't allowed to use a QCDR in 2014. So to be eligible for the Pqrs incentive of 0.5%, you must report 9 measures across 3 national quality strategy domains for 50%, at least 50% of all applicable patients. That's including Medicare beneficiaries and patients with other payer insurance. And at least one of the measures must be identified as an outcome measure. In order to avoid the Pqrs payment adjustment of -2% which would be assessed in 2016, you can report 3 measures for at least one NQS domain across all insurers with 50% of patients reported. And at least one must be an outcome measure. And looking at the difference between what's required using a QCDR and traditional registry, the traditional registries have the requirement for 9 measures across 3 domains, 50% of cases for just Medicare Part B beneficiaries, or you can report less than 9, 1 to 8 measures using a traditional registry, but you will be subject to the measure applicability validation process, which looks to see if you could have reported other measures than you did. The same for to avoid the payment adjustment, you can report less than or equal to 3 measures, or to just avoid the adjustment if you report 3 measures, where you can still get an incentive if you report 3 measures if you're being subject to the MAV and making it through that process. So a little bit about the National Radiology Data Registry, Qualified Clinical Data Registry, also the NRDR QCDR, is the measures in the NRDR QCDR are based on a cross-section of all the 5 databases in NRDR, the CT colonography registry, the dose index registry, general radiology improvement database, IV contrast extravasation registry, and the national mammography database. You can see a list of the measures included in the QCDR at the link shown here. Oops.
So with that, let's go through a little bit more of the details on the QCDR itself. I would like to let everyone know that we will post a copy of this presentation on our website. We will notify all attendees when it's up, or you can always check back on our website you'll see our website as we get through the presentation. But both a recording of the webinar and a copy of the slides will be posted. So If you miss some of the details, don't worry about it. You can always come back to it later. So here's the timeline. At this point, what you can do is register in the NRDR if you're not already and submit a participation agreement. And it's urgent because any facility that does this by the 15th of July does not need to pay any additional reporting fees. And we'll talk about that a little bit more in a little while. Soon, so sometime in July, we will have functionality for radiology groups to be able to enter their TINs and start getting ready to be able to do their PQRS participation through NRDR. You can start or continue collecting data on any PQRS measures that are of interest to you. You can do that now or soon. And as soon as we have your registration and your participation agreement, you can start submitting data to any of the relevant registry databases in NRDR, and radiology groups can sign up to do PQRS measures on the NRDR portal. We don't have the forms for you to actually submit the measures yet. That will happen by late summer. So by late summer, groups will be able to create accounts for each of the individual physicians where physicians can log in, attest to the accuracy of the information, upload PQRS data, and in late summer, you will start to get your semi-annual reports from NRDR and be able to assess your performance at that point. In fall, we will have 10 NPI level reports available on demand for any of the measures that you select, and submission to CMS will happen in early 2015. Sorry, going the wrong way. Okay, so getting started with NRDR. So in order to use NRDR as a QCDR, the first thing to do would be to go to our website and look at the measures, see what you think you might be able to report on that covers 9 measures that you can do across 3 domains. The outcomes measures should not be much of an issue because of the 20 measures proposed out of NRDR, 19 are outcome measures. So if you select any measures from NRDR, chances are you'll hit that requirement. For reporting non-PQRS measures, any of the NRDR measures, go ahead and register for NRDR if you're not currently, and there's more details on this on the website. There is a fee for participating in the registry, which you don't really need to pay us until you start submitting data. In addition, if you don't register for NRDR until after July 15th, so July 16th or later, there will be a PQRS participation fee for this year, which for ACR members will be $199 per physician per year, and for non-members it's $299 per physician per year. There will be reporting fees for everybody next year, but for 2014, if you're already in NRDR, there will be no reporting fee on top of the participation fee. So that's the NRDR website, nrdr.acr.org. You should find pretty much everything you need over on this page. As you see right on the top, we have a link for the Qualified Clinical Data Registry. If you click on that, went too far. Yeah. So if you click on the Qualified Clinical Data Registry page, you'll see a few more detailed instructions on where to find the measures that are available to you. And that's a list, which I understand is too small for you to review, but you can click and review at any time. That's the NRDR measures. So these are not the traditional PQRS measures that you've seen before. These are measures that are based on the registry that CMS has approved for use for this purpose. So registering with the NRDR, again, as we showed you on the NRDR page, we have more detailed instructions. There is a new facility form that you click on and you enter your facility information. If you are part of a group that practices at multiple locations, we have more detailed instructions for the multi-center facilities, which you can again find from our website. You will receive a confirmation email. The important thing that you need to get done quickly is the participation agreement. We really need to have that in order to be able to allow you to submit data. Once we have the PA, you can start submitting data to any databases out of which you want to do measures. And after you start submitting your data, you can make your payment for the participation. That on our website, on the NRDR website, is where there is more information on the registration process. That's a fee structure for groups that are at 5 or fewer facilities. If you have more facilities, the fees are a little bit higher, but you can find more details on this again on our website. There is a one-time facility registration fee of $500, followed by an annual fee that's based on the number of radiologists in your group. Pretty soon, what you will be able to do is declare intent for doing PQRS measures and manage your TIMs. This will be available as an interface off of your NRDR login. So for those of you who are already in NRDR, you probably recognize this, this font and the structure. This is what your manager facility pages look like. But in addition, you will also have this link to manager physician group 10. The thing that's critical over here is to make sure we get the physician group TIM and not the hospital TIM. So NRDR is set up as a facility level registry, so it's possible that the facility administrator is somebody who's a hospital employee or an admin of some kind. You need to work closely with them to make sure we get the physician group TIM, because that's what we need to report on the PQRS.
Because CMS evaluates successful participation in PQRS based on tax ID and PI combinations.
So in addition to the tax ID, you need to give us the NPI for all of your physicians, and you will have an interface to manage your physicians where we will be able to collect information on accurate NPIs for everybody who is in your group. Sometime in late summer, you will be able to start from that physician interface and create accounts for all the physicians who will be reporting for PQRS through NRDR. When those accounts are created, the individual physicians will be able to log in, verify that their NPIs are accurate, make sure they review all the conditions and electronically sign the agreement. As Judy just mentioned, the QCDR will calculate the reporting and performance rates for each TIN NPI that each physician is associated with. We will need procedure volumes to make sure we get the reporting rates correctly. So we will ask you if you're submitting all of your exams to the registry. If the answer is yes, then you have a 100% reporting rate. If you're not submitting all your exams, you started at some point in the middle of the year, or you're only reporting from some of your locations and not others, then we will need you to tell us what the total procedure volume is that you performed for that TIN NPI combination. Once you enter all this information, you'll have a chance to review it, and you'll have to attest to the accuracy. We will also list out what the audit requirements are, that some of you may be audited to make sure the data are correct. And also, in late summer, you will have access to the PQRS measure data entry forms and for the file submission where you can submit data. So here is a sample of what the data entry forms will look like for each of the PQRS measures. You will have one section of the form where you'll enter patient information. The TIN and NPIs will be pre-populated, and you'll select off of a drop-down menu to ensure accuracy. You will then be able to select what measures you want to do for this patient and then enter the measure numerator and denominator. So this is, even for those of you who've been in NRDR, these PQRS data entry forms will be new because these are not measures we've supported in the past, but we will be able to in the very near future. Feedback reports. So as part of the regulation, as a QCDR, we are required to provide feedback at least 4 times a year. So going forward, starting next year, it will be at least quarterly or more frequent. This year, it has not been quite quarterly because we didn't get notified until about mid-year, but sometime in fall, we expect there to be live reports available to everybody at the physician level. You can generate your reports on demand, so you will get fairly frequent feedback. The NRDR facility level reports will be provided in about the July-August timeframe for the first half of the year. For any registry that has physician level reports, you'll receive physician level and facility level reports. In addition to these, your facilities also receive data quality reports right before we run any of these large semi-annual reports. They contain facility level performance data. Please review these carefully because this is what tells you if the data submitted to the registry is in fact what you intended. If there are any errors, the time to correct it would be soon so that your semi-annual reports are correct. Prior to submission to the CMS, all physicians who are using this mechanism for PQRS participation will be able to review the physician-level data. They will need to review and verify TIN and NPI, confirm the volume level to confirm the mapping, so that's facility, TIN, and NPI, and make corrections. And the data submission deadline for CMS is February 27, 2015. Again, just to emphasize, what you should review carefully, make sure that all of your attestations are complete, make sure that your accuracy of TIN and NPI for the group and physician are correct, make sure that your exam volumes on your facility and physician reports are correct. So for instance, if you as a physician read about 5,000 mammograms a year and we send you an NRDR report that says we only had 300 screening mammograms from you, then you know that clearly something is wrong. So make sure you check back with your vendor, with your facility, and with us to make sure that your data is accurately entered. Make sure that all the right measures have the right data, that the exam names are mapped correctly, and that the data are what you expect them to be. So make corrections early. Do not leave it to the end of the year. And also be aware that right before we send data to the CMS, we will ask you to review one last time and approve. So there will be a checkbox, electronic signature, something like that, so that we know you've looked at your data before we send them. For all of our registries, we have feedback reports available on the website. So if you go to the NRDR website, nrdr.acr.org, click on any of the databases, scroll down, you will see under core documents sample reports. You can click on them and you'll see more detailed structures like so. So here are some sample pages from the Dose Index Registry report. For those of you who do the Dose Index Registry, the way the attribution will work is any physicians who are part of a group who read CTs will have the same value for all of their DIR measures. So what we will do is across the board, we will calculate median DLPs and site-specific dose estimates as we need for the relevant measures. And the same value will be reported for every NPI who's part of that 10, or part of that group. So if you are in the Dose Index Registry, pay attention to these numbers, and any one of you may be able to spot if there are any inconsistencies that need prompt attention. You'll be able to see your performance, compare it to your peers. We provide both PDF reports and spreadsheet reports. The spreadsheet reports are color-coded. They show you how you're performing. Here are a few examples of our mammography database sample reports. And as I mentioned, you can go to our website at any point and look for more detailed descriptions.